maintenance of the weight, we have to do the exercise.
Right.
So exercise is for the maintenance mainly.
Right.
And the muscle strength. So initial weight loss, that will be by diet only, and that will lead to the weight loss.
Right.
So obesity in simple language, if you describe, it is increased fatty tissue in the body.
Okay.
Mental health, physical health.
Okay.
And it contributes to the financial losses.
Okay.
So if you look at the calories expenditure,
Huh.
so how much calorie you utilize for your body process. If you restrict your calorie by 500 kilocalorie, what you are taking daily,
Okay.
so you will lose the 0.5 to 1 kilogram per week.
You fast for 17 hours straight?
It is divided into two parts, that is 12 and 12 hours. 12 hours eating period, 12 hours of fasting period. And other is 16 hours and the 8 hours.
Okay.
16 hours of fast and the 8 hours of eating period.
Okay.
So whatever the complications of the obesity we have discussed, so these are reversible. If you lose the weight, you are going to decrease the blood pressure also. You are going to decrease the bad cholesterol in the body, and you are going to decrease or reduce your sugars levels.
Correct.
You have to screen the patient for obesity,
Correct.
diabetes, hypertension. If you introduce your diet, exercise earlier in the course of the disease,
Yeah.
so the prevalence of the complication will go down.
I am Dr. Ashok Hande. I am a neurosurgeon practicing in Navi Mumbai since 1996. I specialize in a surgery for brain stroke.
Hi Prashant, please come. Yeah, good afternoon Dr. Prashant, and most welcome for video channel. This channel was started by us. The idea was to educate people regarding brain stroke, and there's a whole aim of the Brainline project that we started over 4 years ago. And this Brainline project is a brainchild of Purva Medical Trust, which is an NGO, which was founded by us in 2011 to support and promote the brain stroke patients. That's the only intention behind this. And we invite the leading physicians of Navi Mumbai on this podcast to share their experience about their practice, and which can contribute significantly to the brain stroke awareness program. So once more, most welcome on this studio. Now, before we begin, let me tell our viewers about you. Dr. Prashant Gaikwad is an endocrine specialist who is practicing in Fortis Hospital, Navi Mumbai. He started, actually, we are from the same alumni college. The only difference is that I was there in the last century and you came in this century. I took admission for the undergrad medical school in 1977, and he was there in KM Hospital in JSPD from 2009 to 2015. He did his DM endocrinology from West Bengal University, Kolkata, from 20 to 23, and he has a work experience about 8 years. And we had associated with Dr. Prashant Gaikwad since the time he started working in Fortis Hospital, and we had very close encounters in different cases so far, mainly related to the pituitary tumors and post-operative problems to the pituitary tumor cases. So, Prashant, that we will start with this dialogue now. It's more of a discussion than anything else. As if two friends are just meeting up a long time and talking about a subject. That's how it is going to be casual. And we have a tradition to start the podcast with a quick question fire down, which you are supposed to answer in just yes or no.
Yes.
I mean, it's not like Kaun Bhaiya Crorepati where you have options of own a friend or your 50-50 option, nothing of that kind. It's just yes or no. And if at all you want to say anything in reply, you can say in one sentence, but not beyond that. So let's start. Is obesity a disease?
Yes.
Is obesity a pandemic?
Yes.
Is obesity seen more often in COVID-19?
Yes.
Is obesity gender specific?
No.
So it can happen to male also as equally as women. Is brain stroke seen commonly in obese people?
Yes.
Is heart attack seen commonly in obese people?
Yes.
Is an obese child synonymous with a healthy child?
No.
So it's not necessarily if the birth weight of a newborn baby is 4.5 kg, that doesn't mean the baby is healthy. Baby is obese.
Yes.
It is abnormal birth weight.
Yes.
Right. Do you think chances of obesity increase after menopause?
Yes.
Sure. Do you think work from home culture and more screen time is contributing to increasing obesity or yes? Can obesity be hereditary?
Yes.
It could be, but not necessarily. Yes. Right?
So we were discussing about this packaging of the processed food, you know. So the numbers which are written on those for the calories, carbohydrates, fat, everything, those numbers are true.
Yes.
But you have to read it properly.
Yes. We have to interpret properly.
Yeah.
Every gram what has been given.
Okay. Okay. But it's up to you whether to consume.
Yes. Yes.
Yeah. But most of this processed food and packaged food, obviously, they're not good for health
Yes.
overall.
Yeah.
Try to avoid that as much as
Processed
possible.
and the refined foods we have to avoid
Okay.
to prevent obesity.
That's the basic thing.
Yes.
Yeah, that you can't really overrule that. Okay. And do you think the people who use gym regularly and build their muscles, they can't be obese?
They can be obese.
Mm-hmm. They can be obese.
Yes.
So not necessarily building muscles in the gym that not necessarily that you may not be obese, right?
Yeah, they can be obese.
They can be
People who are going to gym regularly.
Yeah, they can go these two. Okay. I asked you this question with one particular reason that when people they think that they're gaining weight and they want to lose weight, the first thing that they come to their mind is to join the GP.
Yes.
So what do you see about that?
So initial weight loss, that will be by diet only. We have to restrict the calories.
Right.
And that will lead to the weight loss.
Right.
After that, for the maintenance of the weight, we have to do the exercise.
Right.
So exercise is for the maintenance mainly.
Right.
And the muscle strength.
Right.
It doesn't add to the weight loss.
It doesn't.
It's for the maintenance.
It's for the maintenance. Yeah. Okay. So going to gym and building the muscles is not really going to help me to lose the weight. Right? If the loss of weight is primarily related to diet control.
Yes.
Yeah. And which you can maintain with some kind of exercise afterwards. Am I right?
Doing the gym will contribute to increasing the skeletal muscle mass.
Right.
And the cardiac tolerance will be increased.
Correct.
So cardiac health will be improved by the gym.
Right. Right. I got your point. Now coming to the main questions. What is obesity? How to define obesity?
So obesity in simple language, if you describe, it is increased fatty tissue in the body.
Okay.
In the simple language.
Right.
So right now, the BMI is the criteria that is used of the defining the obesity. But the newer terms such as ABCD, that means the adiposity-based chronic diseases, it used for the obesity.
Okay.
So obesity has the implication on our mental health, physical health.
Okay.
And it contributes to the financial losses.
Okay.
So it is the overall term that used to describe the obesity as a whole spectrum of the disease that contribute to the physical, mental, and the financial deterioration of the individual.
So obesity is not a simple term which just describes the increase in fat content of your body. I mean, it is a multi-organ disorder affecting multiple organs simultaneously. It is not something which is to be taken very lightly and maybe something which is very serious. Now, when you say there is increase in the fatty component of the body, if I have to ask you, how much does one, say, kilogram of fat must be carrying the calories hidden inside?
So, for the calculation, 1 gram of the fat leads to the 9 calories.
1 gram of the 9 calories. Okay.
So, if to consider 1000 grams, that is 1 kg, that will contribute to 9000 kilocalories.
Kilocalories.
Yes.
Oh. So, if I'm putting on weight, I'm eating on calories 9 times more than the weight of the fat. That's a simple ratio, right? Yeah. So if I put on 10 kg weight, so I'm actually put on 90,000 calories, kilocalories.
Yes.
Am I right?
Yes.
Yeah. So what people say that whatever food I eat, that is ultimately get covered with the calories. Yeah.
Yes.
If I don't spend the calories which I've imbibed, what happens to calorie? Is it necessary that those extra calories get converted into the fat?
Yes. That depends. If you are consuming a lot of carbs, so that will get converted into the fat.
Okay.
So if
All of it.
yes,
Hmm.
if you increase your calorie intake, that is required calorie intake. More than that, if you increase the 500 kilocalorie for 1 week, you may gain the weight of 0.5 to 1 kg.
Okay.
So that is the contribution of increasing the fat kilocalories requirement that is recommended.
Okay.
If you increase the kilocalories, there is going to be gain in the weight.
Okay. 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 So all the carbohydrates and calories created from the carbohydrate, if not utilized, they have to get converted into the fat. There is no other option for that.
Yeah.
No other option. So the people who have live sedentary lifestyle, like we physicians, we sit, we see the patient, examine the patient, then sit in the car, go to the clinic, again sit and examine the patient. Or people who are working in the bank, and we have been taking 3 regular meals, suppose breakfast, lunch, and dinner, whatever, a snack, or supper in between. Now, if you're not doing so much physical activity and if you're imbibing so many calories, so I mean, you getting fat or obese is a natural consequence of that.
Yes.
So, what is abnormal about it? Then what should be done?
So if you look at the calories expenditure,
Huh.
so how much calorie you utilize for your body process, so that is called as the basal metabolic rate.
Okay.
Whatever you are eating, 70% you will utilize for the basal metabolic rate. That will be your respiration,
Just to keep the
Yes.
engine running.
Yeah,
That is
As
it. Okay.
heart beating and everything.
Yeah.
Every physiological process in
Right.
the body that will consume 70%.
Right.
10% will be for thermogenesis, that
Okay.
is the temperature regulation, that will be utilized, and almost 10 to 20% that will be utilized for the physical activity.
Physical activity. Okay.
If you consume excess calories, that 10 to 20% will increase. Okay. So you are not doing physical activity, that 10 to 20% will accumulate in the body in the form of the fat, and that
Okay.
will lead to the obesity.
Okay. Okay.
So that is the basic concept
Okay.
of the excessive calorie.
Understood. You said 70% of the fuel is basically used to run the body.
Yes.
Right? 70%.
Yes.
Yeah. And then the 15-20% again for this kind of your daily activities. That is what I'm saying. Right? Now, is vice versa true? In the sense that if my body does not get enough calories, so I have no fuel to run my body. So what does the body do then? From where does it body get the fuel? Does it take it from the fat where you always store the calories?
Yes, the fat is the main source of the calories when you are having the starvation or you are not taking the food orally.
Okay.
So that fat will be lysed or degraded to have the calories for the bodily process.
Okay.
That is the one process. If you look at the reverse process, what we are discussing right now, if you restrict your calorie by 500 kilocalorie, what you are taking daily, okay, so you will lose the 0.5 to 1 kilogram per week.
Right.
So if you add extra calories, that will be converted into the fat and that will get deposited in the body.
Right.
If you reduce your daily calorie intake by 500 kilocalorie or 1000 kilocalorie, it will contribute to your weight loss.
Right. Right.
That is the main phenomena behind your intermittent fasting.
Intermittent
Loss advice in the obesity.
Okay. So that's the principle of intermittent fasting. What I heard about intermittent fasting, that you fast for 17 hours straight.
It is not like that. Then it is divided into two parts, that is 12 and 12 hours. 12 hours eating period, 12 hours of fasting period. And other is 16 hours and the 8 hours.
Okay.
16 hours of fast and the 8 hours of eating period.
Okay.
Other way is alternate day. You can do a fasting for one day is the eating period. For that also, we have to reduce the total calorie by 500 kilocalorie.
Okay.
And during the fasting period, we have to maintain the restriction of the calorie, and the eating period, we should not overcompensate or we should not take the excessive calories.
Okay.
So that won't be helpful.
Alright.
So restriction of the calories
Okay.
is the main principle behind the intermittent fast.
Now, this obesity, which we have learned, read, and discussed with many people, India is number 2 in obesity next to China. In fact, some people are going and saying that India has become a global capital of obesity in the entire world. Is that true?
Yes, if you look at the obesity prevalence overall, if we consider the BMI, the prevalence is low in India. If you compare with the USA, that is almost 40% in the Indian population.
Yeah.
If you consider the waist circumference or the abdominal obesity for the defining the obesity, then it will increase to almost 65%. So that depends because the Indian people have the more abdominal obesity as compared to the European or the Caucasian population.
Oh.
So that is more contributing to the obesity.
Okay.
So as per the population and the prevalence, India is going to be ranked 1 maybe in the future for the obesity prevalence.
But in the US also, the lifestyle is very unhealthy. The number of people who are eating Kentucky chicken and all these burgers, the number is very, very high. Why they are not so obese like we are in India?
So there is one concept of YY paradox.
YY paradox.
Yes. So in that, it is mainly same BMI people from the India and the same person of the same BMI from the European or the US population. If you consider the total body fat amount, that will be more in the Indian as compared to the US people. So that may be genetically inherited.
Okay.
And most of the Indian people have the abdominal obesity or the visceral fat.
Okay.
That is contributing the obesity and its complication. So if you consider the onset of the complications of the obesity in Indian population, it is more prevalent in the Indian population as compared to the European population. And it is occurring earlier, almost 10 years prior to the whatever happening to the US population.
Okay. Any particular reason for that?
So abdominal obesity mainly. That is causing the everything and the complications of the obesity.
And do you think this abdominal obesity is primarily related to this unhealthy lifestyle?
Yes, if you consider the other factor for that are contributing the obesity in the Indian population, it is urbanization, civilization. We are having the more habits of the Western population, eating pizza, burger, mayonnaise. That is not our culture. Okay. So that is contributing more. Other than that, lack of sleep or the stress or psychological health, that is contributing to the obesity in the Indian population.
I think the other parameters which are very classically seen in South Asian countries.
Yes.
The more stress, I mean, the whole entire lifestyle probably very different than
the impact of the urbanization.
Impact of urbanization. Yeah. The economy is growing fast.
Yes.
Yeah. And with economy, people are having more money.
Yes.
And with more money coming more luxuries.
Yes. Initially it was malnutrition.
Yeah.
It was prevalent in South Asia.
Right.
Okay. Right now with the urbanization, people are having more calorie dense food intake. That may be contributory factor to the obesity in this population.
Yeah, I remember. I mean, during our times, this malnutrition, dehydration were the main topic, discussing the discussion topics, that time. But I don't think now that is remain true anymore.
So we are having the more calorie dense food.
Yeah.
Like the Western population.
Right.
And we are getting the food habits from them. And we are doing that habits daily basis. That is contributing to the obesity, right?
Yeah, as we were saying, Prashant, that once upon a time we used to struggle with malnutrition and dehydration, and now we have gone exactly all the opposite. We are struggling with obesity. Yeah, and it has happened in a very short span.
Yes,
in a very short. I mean, what we are saying, short in something like some 10, 20 years. Yeah, not more than that. So it's a very, very surprising. Now, you told us that why the number of obese, even newborns have gone up in numbers, newborns, I mean, the school-going children have gone up in number. Is it only related to this unhealthy lifestyle, or do you think there is something else in addition to this?
So, for the children, if you consider right now, they are having lot of screen time. Okay. So that may be contributory factor. They are not going on to the ground.
Right.
So they are doing the video games or like increasing the screen time. That is contributing to
Their education also is online nowadays.
yes, yes.
Yeah.
And the post-COVID era, if you see at that, so many of the patients or the children, adolescents, they are coming to me with the obesity and the complication of it like dynamic scale.
Oh, really?
So we know that they are developing dynamic scale. So I'm getting a lot of patients with the obesity and the dynamic scale.
How do you explain it?
Yes. So what happens in the fatty tissue? Yeah, the conversion of the testosterone to estrogen.
Okay.
And that can cause the breast development in the children than in the male side. And that is called as the gynecomastia.
Okay.
So most of the patients, they are complaining regarding the post-COVID era. During the COVID, they had the loss of physical action, they had the sedentary life, and they developed the gynecomastia post-COVID. So that is the one issue. And regarding the stress of the study, they are having lot of stress regarding the study. They are not able to do the time for the playing. So that will be contributing factor. Other factors we have discussed earlier. They are eating the pizzas.
Yes.
That you say, and the high calorie days. That can contribute to the excess calories.
Now, what's this mechanism of testosterone getting converted to estrogen?
So aromatase enzyme that is available in the fatty tissue. Okay. That converts the testosterone to the estrogen. That will act on the breast tissue and lead to the breast development in the male child. So that is the one concern I have found in my practice. Nowadays, post-COVID, they are developing gynecomastia secondary to the obesity.
Does it also can lead to loss of libido?
So long term, if you consider the complications of the obesity, so that may have the impact on our brain also. That in the hypothalamus and the pituitary, that are the glands that are involved in the disease of LH and FSH hormone that leads to testosterone business. So that periodically LH FSH that will lead to the testosterone deficiency in the male. So that can also lead to the loss of libido or the infertility as a complication of the.
Because if the adipose tissue in your body has an ability to change or convert the actions of hormones in the body, it can have widespread effect.
Yes.
Yeah.
So
Either immediate or late.
yes. It impacts the every organ system.
Yeah.
So subsequently, if you discuss the complications, we can go organ by organ. We can know in the more details regarding the complications, yes, obesity and its impact on the every organ.
Right. So tell me in short, how did it affect the heart to begin with?
So heart, it leads to the hypertension, that is increased blood pressure.
Right.
Other things that happens with the heart is the increased risk of myocardial infarction or the heart attack. As equals secondly, and it can lead to the increased risk of the heart failure. So that may be contributory factor. Other factors that they contribute to the cardiac will be pulmonary embolism factors and the patient with the obstructive sleep apnea. So obese patient, they are more prone for the obstructive sleep apnea.
Right.
And that can lead to the resistance hypertension.
Right.
What do you mean by resistance hypertension? These patients are treated with 3 or more drugs. They are not getting controlled with this medication. So the cause of this resistance hypertension is obesity. That is obstructive sleep apnea secondary to obesity. That is contributory factor of the resistance hypertension. So that is the impact of the obesity on the cardiac health.
And then how does brain is affected?
So brain, the effect of the obesity, it may be the simple headache. When the obese patient can develop the simple headache, they may have the increased pressure in the brain, that is benign intracranial hypertension. It may cause the dementia. There is an increased risk of Alzheimer's diseases. In common, if you consider, they are more prone to develop the strokes. Other than that, patient on the depression, anxiety to the body image.
Yeah.
Okay.
Correct.
So these are the impact of the electric on the brain.
And why does the incidence of brain stroke go up in case of obesity? What is the mechanism?
So if you look at the pathogenesis or the mechanism for the stroke, okay, so there are risk factors. If you consider the risk factors, these are hypertension,
Right.
then the dyslipidemia, or that is the increased cholesterol levels, and the diabetes.
Okay.
So these are the factors that are associated with the obesity. If the patient is having the obesity, they are more prone to develop the type 2 diabetes.
Okay.
They are more prone to develop the hypertension.
Right.
And they have the dyslipidemia, that is the increased bad cholesterol, that is LDL cholesterol,
Right.
is in the triglyceride level.
Okay.
And there will be a decline in the good cholesterol, that is the LDL cholesterol.
Okay.
So all this mechanism can contribute to the stroke in a
Okay.
patient with the obesity.
All these changes happens inside the blood vessel which supplies blood to the brain, or whatever the chemical changes that it happens, hormone change happens. Are they reversible with the treatment?
Yes, if you consider the obesity as such, so whatever the complications of the obesity we have discussed, so these are reversible. If you lose the weight, you are going to decrease the blood pressure also. You are going to decrease the bad cholesterol in the body, and you are going to decrease or reduce your sugars levels. So if you consider the diabetes as such, right, what is secondary to the obesity, you reduce the weight, it will the remission of the diabetes. So if the patient is on the diabetic medication,
Yeah.
and he's following the proper diet, doing the exercise, and he's losing the weight,
Yeah.
so that we can stop the medication as such, or we can reduce the dosage of the medication. So diabetes is reversible disease.
Yeah.
Or whatever the complications of the obesity, that will be reversed if you lose the weight.
That I understand. So once you treat the obesity, the complications which are related directly to obesity also go down.
Yeah.
That I understood. What I want to understand from you, that if I get a diabetes type 2 after I became obese, or some changes happen in the heart, my blood chemistry probably will improve. My triglycerides will come down, cholesterol will come down, LDL will come down, sugars will come down, they normalize. But whatever damage is happening, is that damage reversible?
So if you look,
Or the risk remain the same to the person?
so that depends on how much duration you spend with the obesity.
Right.
If you spend more duration with the obesity, and you are doing exercise diet right now, you are losing the weight after 10 years, that won't help.
That only.
Okay. So duration of this obesity, and whatever the duration you are having the hypertension, diabetes, that matter for the overall life survival on the complications of the obesity.
So what you are trying to tell me, that obesity is a disease, needs to be treated. There is no question about that. But the damage which has obesity caused until that time may not be reversed.
Yes.
That is what I'm saying. So there remains a risk, though the risk level comes down,
Yes.
but risk does remain.
From the discussion, we can conclude that we have to start early.
Yeah.
So we have to screen the patients.
Correct.
We have to screen the patient for obesity,
Correct.
diabetes, hypertension. If you introduce your diet, exercise earlier in the course of the disease, so the prevalence of the complication will go down.
Right.
Okay. For everything in the body, there is a memory. Okay. That will affect your DNA or the genetics.
Right.
Okay. So that will have the long-term impact.
Right.
So earlier you intervene, the less is the impact of this obesity and the complications of this.
Okay. Fine.
So we have to intervene at the earliest stage. If we are intervening at the overweight stage of the patient who is presenting with you overweight, you are explaining the patient regarding the diet and the exercise, and he is following that. After that point, the rate of the complication may be lower in that patient.
Right.
You start at the obesity level, patient is having the BMI almost 40, and he is not doing diet exercise, he obese since 10 years. So the complication is set up here. Okay. At that point, to do the bariatric surgery.
Okay.
So the risk will be reduced at that point, but the total impact of this obesity over 10 years will be there at the genetic level. That is called as molecular memory also.
Right.
So that has the impact.
Yeah. So this screening of obesity, according to you, should start at what age?
So
We can't pick up a obese child and testing, right? There should be screening, on a regular basis at some. So at what age it should start?
So school going age, I will say.
Yeah.
So earlier you start, that will be the better option.
So what, 8th standard onwards? Something like that, or even earlier?
Even earlier,
Even earlier.
because with this pandemic of the obesity, if you start at the age of 5 to 6 years, okay, will be okay. So we have to screen every year for all the parameters of the obesity.
Correct. So can you enumerate me what are the parameters for the obesity? Which one to screen the babies or boys or girls at the age of 5?
Yes. For the boys or the adolescent people, if you consider the BMI criteria is most of
Right.
okay. So in that we have to do the weight that is in the kg, and we have to divide the weight in the kg by the height in the meter square. Okay, that will give you the BMI. So there are percentile of the obesity, or the charts are there to define the what level of the obesity the child has. So okay, that is for the children or the adolescents. From age of adults, we have the other parameters also. In the adults, we can use the BMI, and the BMI has the limitation as such. If a person is the muscular, is having more weight, so the elevated BMI will be there in such person. So it has some limitation. In such cases, we can use the other parameter. So these parameters are waist circumference or waist hip ratio, and the other parameters such as the total body fat analysis. From that, we will get the total amount of fat that is present in the body. So if it is more than 30% in the female, that is the obesity. More than 25% body fat is there in the men, you need obesity. Okay, these are some of the parameters that is newly used to define the obesity. And the recent one article is in the Lancet published recently. So they have the different definition of the obesity. It is subclinical or the clinical. Okay, so what are the implications of the obesity? It is not only the presence of the obesity, but it impact on the overall health they are considering.
Right.
So clinical obesity, they are defining as the endowment damage due to the obesity.
Right.
And the subclinical, the patient is having the obesity or fitting in the criteria of the BMI or waist circumference, but not having the endowment damage. That's so we have to look at the patient's limitation for the physical activity or the patient's mental health due to the obesity, also the economical burden of the obesity.
Right.
So we have to look all the parameters thoroughly to define it as obesity.
So obviously, if you want to do screening of children at the age of 5, then what most significant is what is the body fat analysis. That's what you're trying to calculate.
Yes,
right. That's the main idea. But to do that, which is more relevant and more useful and user friendly kind of a test, where I don't have to go to too many gadgets and this kind of thing. One you said is the BMI, then you said about the waist and hip ratio, that is number 2. Now, how do you do this body fat analysis? Is there a machine which?
Oh yes, this is the separate machine that is called as the bioimpedance machine that are available. We can do the DXA, dual X-ray absorptiometry test also. That we calculate the total body fat and the total skeletal mass. How accurate they are? So they are very much accurate as compared to the other parameter you consider. So that are the standards actually. But the issue with the cost. Okay. So with the cost effectiveness, we use the waist circumference or the waist hip ratio. So that may be more useful, and this is used for the mainly for the study purpose or the research purpose.
Okay.
So people are using the DEXA scan or the bioimpedance for the research purpose only right now.
They are very expensive.
Yes.
They are very expensive. So what are that we are using, say BMI or waist to hip circumference? That is good enough to give it an idea.
Yes. It's good enough. For the Indian population, the waist circumference you use the female more than 80 or the male more than 90 centimeter. That will define the obesity. If you look at the waist and the hip ratio, if it is more than 0.9 in the men and the more than 0.8 in the female, it defines the obesity. Or we have the specific criteria, and these criteria are different for the Indian population or the Asian Western compared to the Western population.
Once you define a person obese or declared obese, are there grading in Korea?
Yes. Yeah. So it depends on the BMI. So first will be the normal BMI.
Right.
Then there will be the overweight and the obesity.
Okay.
When the obesity, that can be divided into the grade 1, 2 and the 3. That is called as the morbid obesity. That is grade 3 obesity. So that depends on the BMI. And these criteria are mainly used for the treatment of the patient. At what stage we have to go for the medical therapy, at what stage we have to go for the bariatric surgery, and what stage we have to just advise the diet and exercise for the patient.
So when you talk of obesity grading 1, 2, 3, it depends on organ involvement.
So it is mainly the BMI grading, that is the obesity grade 1, 2, 3.
Yeah.
They have divided.
Right.
So there is a other classification, that is Edmonton classification, that has involvement of the your mental health, then the physical restrictions,
Right.
or the financial burden or end organ damage.
Okay.
If any of these are present, there is a staging of the obesity, and according to obesity, the treatment will change.
Obviously. Yes. Okay. But morbid obesity means it is some kind of malignant obesity.
Yes.
That is for sure.
Yeah.
And this kind of morbid obesity, malignant obesity, even if you take a treatment, the damage which is already done may not be recoverable.
Yes.
Am I right?
Depends on the duration.
Depend. Yes. Understood. Yeah. Now, I keep hearing the people saying, when I tell my patients to lose weight, they always come up with one very funny sentence. They say, I only eat so much. I only eat so much. I don't eat rice, I don't eat potatoes, but I'm still putting on weight. So what they're saying is true?
Yes. Some of the patients are coming to me with such complaint.
Uh,
So simple solution for this, just ask the patient to have a diary and write down whatever they are eating from the morning to night hours. Okay. So for 7 days, they will prepare the diaries and they will go to the dietitian. They will calculate the total calories. Okay. From that, we will get the idea of the calories intake. Actually, patient, they are saying such thing, they are binging in between. Okay. So binge eating, that can contribute to the excess in calories. Okay. So they are not considering that binge eating as a total food intake.
okay.
So that may be the contributory factor. That's it. So the simple solution is total calorie intake calculation.
Prashant, India is a country with diverse cultures and festivities, and we have festivities round the clock in a year. And traditionally, we tend to eat too much of a sweets and oily stuff, which is very common in India. So, and after I discuss and learn about obesity, probably I don't know what must be happening to incidence of obesity during these periods. I mean, people must go and binge eating for the sweets and stuff like that. Have you seen more admissions under your care during this period due to obesity-related complications?
Yes. The patients, they are coming to the OPD in the complaint of weight gain and they are not losing the weight. So during this festival period, what happens? We do the binge eating. They are coming to the OPD with the complaint that they are not losing the weight. And if you take the detailed history, they will reveal that during festival season, they had a lot of sweets or excess calorie intake, and that is contributing to no loss of weight or they are gaining the weight.
Yeah.
So that is the one factor.
Yes.
So for the obesity treatment, we have to be disciplined. Okay. Throughout the period, we have to restrict the calories. It's not like the 1 month, 6 months or 1 year.
It's a lifelong commitment.
Lifelong discipline, and we have to be strict or the discipline with your diet or like no.
Yeah. What I was trying to ask you is that suppose you have some patient who is in obese grade 1 and 2, during this period of binge eating in festivals, have you seen patients who are grade 2 getting converted to grade 3, becoming more serious and stuff like that? Or people who are always manage the medicine suddenly land up with a multi-organ failure or a target organ failure? Have you seen this kind of phenomenon happening?
So what happens? What are the complications of the obesity we have discussed? They are getting exacerbated. So patients who are diabetic due to obesity, they are having the uncontrolled diabetes after the festival season.
Right.
Or they are having the hypertension uncontrolled. These things are happening. Festival period, we are getting such reports, or it will be the dyslipidemia that we have this lipid profile negative range post festival. So these are the acute complications. So that for the period of the festival season or post festival season, they are getting this complication.
Right.
So that may be contributory to the mismanagement of the obesity, and there could be the conversion from the grade 1 to grade 3.
Yeah. See, when you're interns in I'm talking 1992 period, so which we posted in the casualties and years in Kenyan hospital. And one phenomenon we observed very, very commonly and very frequently, the people who during this full moon or no moon night, what you call it, Amavasya and Purnima, we have sudden surge of patients with asthma coming in the casualty. I mean, so many that in a night we should something like 30, 40 patients with asthma landing on the day of Purnima or Amavasya. So we never to understood the reason. And then we had told our teachers that during these 2 days, the gravitational force is so powerful, because of full moon or no moon, and because that changes in gravitational force, this asthma becomes gets aggravated, that get exacerbated. That we have seen pretty often. What I'm trying to ask you is, like when you talk of asthma, obviously you're talking of smooth muscle unsuction of the tracheobronchial tree, So does something, have you ever observed in case of patient who are diabetic, patient who are hypertensive, patient who are obese, during this period, suddenly you start seeing more patients. As you see,
So such observation is done by one of my colleague.
oh,
He used to tell that during this period, the stroke patients are increasing.
yes,
And this number of the patient during this period will get more and more patients will be admitted with the stroke.
yes.
So that is the observation by him
Oh,
as such, and he's planning to do such study.
yeah,
If it is there is any correlation between
yeah.
gravitational
But
force.
there is more scientific support. For
Yes.
just one observation.
And regarding asthma, it could be the winter that is the more predominant. We see the more exacerbation during the winter season. So that has the scientific explanation.
Yeah, but not other things.
Yes.
But we had seen patients with brain hemorrhage. Again, as you said correctly, and more of an observation in a long years of practice rather than there in scientific evidence. Okay. Is it difficult for women to lose weight more than the men? I mean, can men lose more weight effectively than the women?
So if you look at the physiologies, what the women have, the childhood, then puberty, then the pregnancy, and then postmenopause. Okay. So during that period, what happens? There are the hormonal changes. Where the estrogen, what is required for the good metabolism, that is declining over the period. So that has the impact on the postmenopausal element, guys. And if you look at the role of the testosterone, it has the impact on the skeletal muscle. Okay. So less fat will be there in the male as compared to the female due to the effect of the testosterone. Right. If you look at the body distribution of the fat in the female and the men, that means more gynecoid type of the obesity in the female. That is mainly in the lower thighs.
Right.
Okay. So that will be more common in the female. Okay. You consider men, that you more android obesity. That's the more abdominal obesity. So that has the impact. The hormones has the impact on the type of obesity also, and the prevalence of the obesity in postmenopausal women.
Right. I'm talking of people who are in 30s. Yes, for example, and who are obese. I mean, who is little better at losing weight? A girl or a boy? In 30s, and talking.
So as such, if you consider gender wise, I don't think there is any difference. So the patient who are doing dedicatedly the diet restriction or following our advice and doing it disciplinedly.
Yeah.
So they will more prone
So can do equally well.
Yes.
It's not that
I don't think there is any gender difference at the premenopausal age or the during adults
that is
or the adult life.
fine. What is metabolic syndrome?
So metabolic syndrome, it is nothing but the compilation of the complications of the obesity. If you look at the metabolic syndrome parameter, the waist circumference we have discussed, more than 80 centimeter in the female and more than 90 centimeter in the male. That is the one component. Other than that, the patient having the hypertension, the blood pressure more than 130/85, or patient who is on hypertensive medication, or patient having the fasting plasma glucose more than 110, and or patient having the medication for the diabetes, or patient having the triglycerides more than 150 milligram per dl and the HDL less than 40 milligram per day. So these are the 5 parameters for the metabolic syndrome.
Okay.
To define the metabolic syndrome, we should have the 3 parameters out of 5 to be positive. So that defines the metabolic syndrome. Metabolic syndrome is nothing but the complications of the obesity that are defined with the certain parameters.
It doesn't give a name, basically.
Yes.
It's not something new that we are talking of here. Okay. Isn't a grading in metabolic syndrome?
No, as such, there is no grading.
Okay. Generally speaking, what kind of food you will tell the patient to avoid if they're obese?
So if you look at the food to be avoided, it will be the processed food or refined food.
There is absolute no.
No for that.
Okay.
Then for the trans fat, I will say no. Then the excessive sugars or the butter, that we will know for this, and the red meat also, or the products made by the maidas that is usually used in the India. We have to avoid that. Even for the rice, we should prefer the brown rice over the white or processed rice. So these are the restrictions. And for losing the weight or the calorie restriction, it is not depends on the overall what you are eating, how much you are eating, how much calories you are eating. That is important thing. So if you take the regular diet also and you are reducing whatever calories you are taking, that will be more beneficial.
Okay.
It is not like this is a strict diet, you have to follow that, or the costly diet is more helpful for the reducing the weight. Different concept. It is about the total calories, what you eat. If you reduce the 500 kilocalories per week or the per day, you will lose almost 0.5 to 1 kg over the week, and that will proceed for the months also. So over the period of 6 months, you expect 5 kg weight loss, or it could be 10 kg. Depends on your the baseline. So diet as such, it is the number of total calories. It is not the composition of the diet you are getting.
Now, you already have spoken about preventive measures and different modalities for obesity. Now, with obesity, earlier you said that there could be more hormonal disturbances. That is number 2. So, when you try to manage a patient with obesity, say whatever by any means, by medications to control cholesterol, whatever means, or weight loss or diet and nutrition. So you always test them for any hormone levels.
So for the obesity as such, if you consider any endocrinological disorder or hormonal disturbances, so one will be the Cushing syndrome, that is increased cortisol level in the body.
Okay.
So we have to rule out that one.
Okay.
Other than that, the patient should be screened for the hypothyroidism.
Okay.
The hypothyroid patient had the 3 to 4 kg weight loss, weight gain. That is not more than the 3 to 4 kg.
Okay.
We are expecting the hypothyroidism. Other than that, if the child is coming with the obesity, he is having any syndromic feature, such as visual blurring or the hearing loss or the mental retardation or polydactyly, that is increased number of the fingers or something like that, you have to suspect the syndromic obesity. So these are the contributor to the endocrine obesity as such.
So unless until you see any endocrine problem, routinely you don't get endocrine workup.
Yes.
That is what I am trying to ask, right? So this 5 parameters you said in metabolic syndrome, apart from that, you don't get an endocrine workup done unless until you suspect it clinically.
Yes.
Am I right?
Yes.
I think, Prashant, that really covers almost everything as far as basis of obesity is concerned. Anything else you want to tell the viewers that they should be knowing about basics of obesity, apart of what we discussed?
So just check your weight regularly. You have to keep check on your weight also. Other thing, you can modify your diet if you are overweight or the obese. So there are certain method, the plate method, that is commonly used. 9 to plate, we have to take 50% vegetable and the fruits. The 25% will be the whole grains and the 25% will be the protein.
Okay. What is called the 9-inch plate?
Yes, that is the plate method. It's commonly used.
Okay.
For the healthy diet.
Okay.
And other thing, you have to do the 30-minute exercise daily.
Okay.
That will be cumulative 150 minutes per week. You can should not take the gap of more than 2 days in the regular work. And it should be aerobic exercise also and the resistance exercise.
Okay.
So you can do the 2 or more sessions of the resistance exercise, such as weightlifting or the resistance band. that can be used for the resistance exercise.
Okay.
And the aerobic exercise you can continue throughout the week also.
Okay.
So that will be more beneficial. Just take care of the calorie count. Okay. You should not take the excessive calorie. If you are willing to lose the weight, just reduce the 500 kilocalorie. And it should be the graded manner. Okay. It's not like you are starting with the 16-hour fasting every day. So it should be graded. You start the 12 hours, then go for the 16 hours.
Supervised one, basically.
Supervised one. Even for the exercise, same, you should do the graded. If you are going to the gym, you should lift the smallest weight initially, then gradually you can increase. Okay. So otherwise it will lead to the injury. Okay. And the permanent stoppage or the temporary stoppage of the exercise may be advised.
Yeah. Okay.
So we have to take care of all these ends, and it should be the graded process, not the immediate process. It will take time. Patient has to be disciplined over the period of the treatment for losing the weight.
Do these obese patients tend to have deficiencies of vitamin D3, calcium, B12?
Yes, most of them have the vitamin D deficiency.
Any reason for that?
It could be the less sunlight exposure. That could be the
That's one thing.
and the metabolism of the vitamin D may be affected.
It is also affected.
Yes.
So obesity can primarily cause vitamin deficiency.
Yes, it could be.
Directly.
Yes.
Right?
Or it could be the secondary to bariatric surgery.
Okay.
So this patient who underwent the bariatric surgery, they are more prone to lose the fat. Okay. Or the absorption of the vitamin C they affected in pathology. So fat soluble vitamin whichever are the available that may be deficient in such patient. So post bariatric surgery we have to take care of the vitamin deficiency in such patient, and we have to screen and we have to supply the vitamins if it is deficient in this patient.
This patient who undergo bariatric surgery, after surgery, what advice do you give to them?
So post bariatric surgery also they have to take care of their calories also.
Okay.
They have to be following at the frequent intervals. They have to look for the vitamin deficiency or post bariatric complication. They may gain the weight again after the bariatric surgery if the calorie intake is not in control. Okay. So even after the bariatric surgery, some of the patients are gaining weight. In such patients, we have to restart with the medical management. So we have many of the medications right now, from the orlistat to GLP-1 analogs, liraglutide, semaglutide, newer drugs like tirzepatide. These drugs are available for the management of the obesity. It can be given preoperatively also or the post-operative if the patient is gaining the weight after the bariatric surgery.
Right. So, Prashant, thank you very much for coming here. And to summarize this podcast, what I would like to say that obesity is one of the major risk factors for brain stroke. Yeah. So, it is also a major risk factor for your kidneys or other organs like heart. But since we are talking here from Brainline, that it is one of the major risk factors for the brain stroke. And because obesity per se will lead to diabetes and hypertension, which are still bigger risk factors for the brain stroke. So, thank you so much, Prashant, for joining us. And I am sure you will give me another opportunity to meet again to discuss something beyond this. So, thank you so much.